Next, I'd like to introduce to you Tommy Gonzalez, City Manager for the City of Irving, which has a brief statement he wishes to make.
Thank you all for coming this morning. But I'd like to share with you some examples where Lean Six Sigma has worked for the City of Irving. And I'm talking specifically about our organization and how it's been implemented. We started doing this about 3 years ago, and the results we've achieved have been $38 million in savings, and we've been able to reduce processes so that the customer, the resident, gets the service quicker. A good example is, what if an organization had a commercial permitting process that took 3 months in order to implement, in order to get that commercial permit completed? Well, that costs the business money, that costs the city money, because that facility can get constructed a lot sooner, get on the tax rolls, helps the overall burden. Well, we went from 3 months to 3.5 days. So I think that is a significant service delivery that saves money, makes money. Another example is we went from 14 weeks in doing sidewalk repairs to less than 6 weeks on a consistent basis. And then we have these systems in place to keep these type of results in place. We saved $18 million on an energy contract to buy electricity. A lot of people don't attack their fixed costs. Our fixed costs across the board for the city was $12.5 million. The use of Lean Six Sigma helped us reduce that to a little bit over $8 million. So we're going to save $18 million over the life of that contract. We've already realized $12 million in savings. Now, the City of Irving has not been immune to the economic downturn that the rest of the cities in Texas have had to endure. We've also been impacted. We've lost over $22 million in revenue. But we made that up through a lot of these service improvements and by eliminating costs that were unnecessary. We also have looked at positions where we have vacancies, and we looked at, can we do it better, can we do it more efficiently? And we've not filled 215 positions, all the while increasing the service levels to the public. Our service levels have increased in double digits. So we think that demonstrates that you can eliminate the deviation in activities that people are involved in on a day-to-day basis, and you can eliminate the waste. And I think that phrase, eliminating waste, seems to be synonymous with government, but it's also synonymous with any organization. There's waste in any organization if you look hard enough. And the waste simply means that there's activities that are no longer necessary. And you can just eliminate that portion of it and listen to the customer, whether that be the resident, whether that be that you call them a taxpayer, whether you call them the customer, because they're the people that pay you for a service you provide as a business. It does not matter. There's ways that you can look at the process, improve the process, eliminate steps. So when you eliminate those steps, you have less activities to do. So when you do have less people, there's actually less work to do. And they're doing more of the work that the people want you to do, whoever the people are that you're serving. So that's how we've been able to do it in Irving. And we believe it can be used in any type of organization where service is being provided. And definitely it's been proven to be very successful in the private sector, where widgets is the name of the game, producing X amount of widgets in order to get a profit. So I'll be able to answer any questions if you have any, but I'll turn it over now back to the representative.
Thank you, Mr. Gonzalez.
Yeah, for Mr. Gonzalez, you said that you had $38 million in savings so far?
Yes, sir.
Is that direct savings, or is that, that's out of your budget? You're saving $38 million from your, and added to your budget?
We have gone from $180 million budget to $163 million budget. So we can prove 100% over $25 million is actual hard savings off the budget. The $13 million were cost avoidance. And the examples of cost avoidance, we had the Animal Services Advisory Committee as an example. They wanted to hire 5 animal services attendants. It's going to cost us somewhere about $250,000 when you have their benefits and their salary. We have a custodial staff, and they clean. And so Six Sigma pushes you to the main issue. The main issue is the cleaning of the cages. And so we thought if we add a little bit more money to the custodians, maybe that would provide the benefit that was required and save the money by not having to hire those 5 people. So the lowest paid employee in our city got a little extra. So we spent $7,000 and saved $243,000. So that's an example, because otherwise we would have had to hire those positions. To your other question, in terms of, we're the first city in the state of Texas to implement this across the board throughout the entire organization. The second city in the United States. The first city was Fort Wayne, Indiana. And Mr. George writes about that in his book.
And so, looking at your experience as a city manager, how would you think that would relate to state government as well?
Well, you an example we just completed yesterday. Xerox machines, Xerox copiers, just printers, and everyone has printers. There's lots of printers in this building, right? We reviewed that through a Lean Six Sigma process in partnership with Xerox, because now companies are approaching us with the Lean Six Sigma product, because they know that's what we do, so they know they're going to get our attention, and that's how they provide a proposal to us. So in working in conjunction with them and looking at how can we save and doing a time and motion study and doing a review of all of that, we're going to go from $630,000 to $400,000 we're going to pay on an annual basis. So we're going to save $230,000 of hard savings right off the budget. That's an example of how we partner. Now, Cigna is our third-party provider for healthcare, and a lot of what we're now using Lean Six Sigma for is our fixed costs. Everyone has to pay for healthcare costs, right? And it's constantly going up. We partnered with Cigna, and we're reducing our costs by $800,000. That's the result. The way we did that is right now when you go and seek medical care, the way it usually works is you go to the GP, the general practitioner, and then they'll send you back for another appointment, and they'll say,